This year, we're raising money in support of medical imaging at the hospital. An portable ultrasound for the emergency department, as well as replacement of 6 ultrasound machines and probes for the imaging department. This is just a huge undertaking. The ticket price is well over $1 million for these items. It's going to benefit everyone in the community. Over 15,000 images are taken annually using these pieces of equipment, so everyone in the community is going to benefit.
We look after about 130 patients a day. We take all comers, walk-ins through the door, and all ambulances from our surrounding area. There's no real typical day for us. We can go from seeing a sprained ankle when somebody's camping and steps in a hole, and then the next case can be a multi-vehicle pileup. Everybody from children to adults to seniors. This is a really important bit of gear for us. In the last 10 or 20 years, the point of care ultrasound, and what that means is an ultrasound machine that we can bring to your bedside, has really changed the way that we see and treat a lot of patients in the emergency department. The ultrasound machine that we have, we use for everything from, say, locating an abscess that we need to drain, all the way up to assessing a seriously injured trauma patient for internal bleeding. And so really another machine that's capable of doing these things would be invaluable at this point.
I went and bought a used bike, and I couldn't lose the smile off my face, and I just felt like a kid again, really. So I brought it to one of the practice nights, tried it, and absolutely loved it. And last year I was 3rd in Canada in my national age group, which was 50 to 55. And I aged up. I'm 56 to 60 now, and currently in 1st place. It was an instantaneous accident, and I was just coming in too fast, and I crashed really quickly on my left-hand side. The accident led me with very injured, cracked ribs, very difficult to breathe at that time. I was brought straight to emergency. And when they had a look at me and I was having a hard time breathing, they admitted me right away, which I was really grateful for. They knew exactly what they were doing, and that felt comforting. I just trusted the process. They were extremely knowledgeable, and I felt in good hands. My overall feeling is that like I said, I was very grateful that I live in the Comox Valley and I have such a resource as that hospital and the expertise that's there.
People start getting ultrasounds before they're even born. They get them throughout their life. They're used in screening, they're used in diagnosis, they're used in treatment, and then they're used to give us the all clear. The recheck after 2 years. My mom is a cancer survivor and she goes in for her rechecks. The lifespan of an ultrasound machine is generally about 7 years. Depending on the day, depending on how many staff we have on, each machine will do about 2,500 per year. So they get a lot of wear and tear. And so we're reaching the 8-year mark for our current equipment. And it's been a workhorse. They have been so good. They have, serviced our population and our patients so well, but we need new ones.
As our community grows, so does the pressure on our hospital resources. Healthcare staff do an incredible job of handling the increased volume and providing excellent care. With nearly 40,000 visits through our emergency room and over 100,000 scans and x-rays provided annually, diagnostic equipment is in high use and requires replacement to meet the needs that we're seeing here at the Comox Valley Hospital. I really appreciate working with the Foundation so that we can advance projects like the ultrasound suite replacement initiative quickly. Patient care benefits from the community's generosity, and that is our collective goal.
The Comox Valley Hospital Foundation has really gone above and beyond for our department. They've funded all kinds of pieces of equipment, some of which you probably see in the room here. We're a small enough community, a town of 50 or 60,000 people, that the donors that we have are the people that are using these services.